Hi, Mrs. Jackson.
Hi, Dr. Schoenberg.
I've been reviewing your records, and it looks like you haven't had a colonoscopy in about 10 years. So I think we need to talk about whether or not you want to continue getting colonoscopies.
You don't think I should get a colonoscopy?
Well, it's not clear. I think it is important we talk about the benefits and risks so that you can make an informed decision.
Oh, definitely.
Great. Many of the things we do in medicine, we do now to help a patient in the future. For example, when we do a colonoscopy, we do it now because we think at best it may help a patient in 10 years. So, on average, it's estimated that about 1 in 1,000 older adults that gets a colonoscopy may avoid death from colon cancer in 10 years. But when a patient goes for a colonoscopy, they immediately put themselves at risk of the harms of colonoscopy.
Like what?
Well, I'm not sure you remember your prep from 10 years ago, but as patients get older, we think that when they undergo the prep, they're more and more likely to experience weakness or dehydration. Some patients have problems with the procedure itself. They can experience pain or discomfort or bleeding. Other patients have problems with the medications we give them during colonoscopy. And very rarely, the colonoscopy can cause a patient's bowels to burst open, and obviously that's a serious problem.
I see. What do you think, doctor?
Well, based on what I know about your health, I think it is very unlikely that getting another colonoscopy is going to help you live longer. Based on your other medical conditions, you have a very small chance of dying from colon cancer. Meanwhile, those same conditions put you at greater risk from experiencing the harms of colonoscopy.
So you don't think I should get a colonoscopy ever again?
Well, there's a lot of variation in how patients may do, and while I'm not sure it makes sense to go looking for something that may or may not cause a problem in the future, if you were to experience change in your bowels or bleeding or pain, I would still recommend a colonoscopy. But again, to look for something that may or may not be a problem in the future, I'm not sure that makes sense. Instead, I think we should talk about whether or not you're exercising. We should focus to make sure you're taking the right medications. What do you think?
I think that's a good plan. Let's stop doing the colonoscopies.
So one of the things I've hinted at in this conversation is your life expectancy, or how long you may have to live. I've been learning from some of my patients that it can be helpful to them to talk about their life expectancy or how long they may have to live to make better medical decisions. I've been learning that some of my patients don't want this information. I wanted to use this time to ask you whether it would be helpful to you to talk about your life expectancy or how long you may have to live.
You don't think I'm about to die, do you?
No, and nothing's changed. I just think it's important to think about how long you may have to live to make better medical decisions. I realize that this is an uncomfortable conversation, but again, I think it is important, just like it's important to think about how long you may have to live when planning for your finances.
That makes sense. Thank you for bringing this up.
We doctors think prognosis is really important so that we don't order tests that can only harm you and not benefit you.
Do we need to talk about this now?
No, we do not have to talk about it today. In fact, we don't have to talk about it at all. Either way, I will make recommendations to you based on what I think can help you and not hurt you.
I don't like to think about it, but I understand it helps me to plan. Doctor, it sounds like you might think I don't have very long to live. How long do you think I have?
Well, no one knows exactly how long someone may have to live. Increasingly, there's more and more data and tools to help us doctors estimate how long our patients may have to live. But before I get into that, I wanted to ask you, what are your thoughts, or what are you thinking in terms of how long you may have to live?
I don't know. I'm starting to think about it so I can plan my finances and take care of my family. And I have started to give away some of my stuff.
Well, it sounds like then some of the information I'm telling you may not come as a surprise. Based on what I know about your health and your age, I would estimate that your life expectancy is 5 to 7 years. It could be more, it could be less, but if I had to give a best guess, that is what I would say. It looks like that may have come as a surprise to you.
Yeah, a little bit of a surprise. I thought I might have 10 years. Who knows, though? I have been in and out of the hospital a lot lately. That last time was pretty bad.
It was really bad. You were really sick. I was really worried about you. Please don't take what I have to say about prognosis as a prescription. It is an estimated guess. My patients surprise me all the time. I want you to live longer. I worry you might not. No matter what, I will do whatever I can to help you live as long as possible in the best health as possible.
Thanks, that's my goal too. I do want to talk this over with my family.
Absolutely. I'm happy to answer any questions you have or that they have. Do you want to schedule to bring them in at the next appointment?
I know my daughter would want to come.
Good, so let's plan on bringing her in and we'll discuss this again at the next visit.